Counselling is a long-term commitment, a process that generally involves patient-led treatment where you'll have a confidential chat with a professional. You'll lead the session because you'll discuss the problem or problems you want to deal with, and then the counsellor can make suggestions. It is a therapeutic approach in that it can provide relief and alleviate many issues you're currently experiencing. However, counselling is usually focused on the right now and the challenges you currently face. Psychotherapy is a more strategic process and is a term to encapsulate various approaches such as cognitive behaviour therapy. Therapy follows a defined treatment programme, can be shorter than counselling, and it focuses on outcomes rather than inputs. Essentially, it's designed to help equip you with the tools needed to manage or overcome your mental health conditions. Unlike counselling, the sessions are therapist-led and collaborative. Therapy focuses on your experiences, habits, behaviours, identifying the triggers that can contribute to your current mental well-being.
There are many different types of therapy available, but which works best for you will depend entirely on your own life, experiences and way of thinking, and what you are wanting to address. I will briefly explain the most prevalent treatments in the UK. So CBT, that's a practical therapy system based on understanding the relationship between our thoughts, feelings, behaviours and physical sensations. This model of therapy can be used to treat a range of difficulties, such as anxiety, depression, trauma and psychosis. Cognitive analytic therapy, also referred to as CAT, is about assessing how a person thinks, feels and acts and the context of past events and relationships that may affect this, and again can be used to treat a range of difficulties. Interpersonal psychotherapy, IPT, is a relationship-focused therapy that helps people with relationship difficulties or poor interpersonal skills which may be contributing to their negative well-being or depression. Family and couple therapy, sometimes referred to as systemic therapy, is looking at systems in which you exist. It's based on how your family, which doesn't have to be genetic, can impact on well-being. It generally involves clients as groups such as couples, families, carers, teams or businesses. EMDR, eye movement, desensitization and reprocessing. That therapy is a structured therapy that encourages the patient to briefly focus on a trauma memory while simultaneously experiencing bilateral stimulation using the eyes, which is associated with a reduction in the vividness and emotion associated with the trauma memories. ACT, or acceptance and commitment therapy, encourages people to embrace their thoughts and feelings rather than fighting or feeling guilty for them. ACT develops psychological flexibility and is a form of therapy that combines mindfulness skills with the practice of self-acceptance. CFT, or compassion-focused therapy, aims to help promote mental and emotional healing by encouraging people to be kinder and more compassionate towards themselves and other people. DBT, dialectical behaviour therapy. Whilst CBT focuses heavily on changing our thoughts, DBT focuses on accepting and changing our behaviours. DBT is an evidence-based psychotherapy that began with treating interpersonal conflicts and difficulties. Recent evidence suggests that DBT has also demonstrated value in treating mood disorders and suicidal ideation, as well as for changing behavioural patterns such as self-harm and substance abuse. Mindfulness involves paying attention to what is going on inside and outside of ourselves, moment by moment. There are many mindfulness-based treatments now with a strong evidence base, such as mindfulness-based stress reduction or mindfulness-based cognitive therapy. An important part of mindfulness is an awareness of our thoughts and feelings as they happen moment to moment. Humanistic therapy has a focus on self-development and growth, looking mainly towards exploration. Psychodynamic or psychoanalytic psychotherapy is a process of analysing the unconscious thoughts you may have developed during childhood and how they're impacting on your current life and behaviours. With so many options available, it's almost always better to speak to a therapist before determining which therapy might work for you. A professional will guide you towards a route that suits you, that's matched to your difficulties or needs, and whether a single type of therapy such as CBT or a more integrative approach that brings multiple techniques into your sessions is most appropriate. An integrative therapy is an approach that involves the combination of elements of other therapies to produce a bespoke and personalised treatment plan built around you. Unlike counselling, a defined therapeutic practice is typically delivered in an intense treatment plan over a short period, and it's often beneficial to go with an integrative approach to help equip people with various tools that can help them navigate challenges without relying too much on one approach.
So why are there so many different types of therapies? There are different types of therapies because of different schools of thought, areas of research, academic institutions with different values and different cultures. Also, different therapies have proven to be more or less effective for different types of mental health conditions, therefore attracted more or less research attention. There are different types of therapy because therapists have had different training and have different styles, values, beliefs, backgrounds and ways of working. Just as you are unique, so too are your therapists. So all of these differences have led to a multitude of therapy techniques that vary in their effectiveness for different people. There is no one-size-fits-all approach, as some strategies and approaches work for some people, but we have not yet and probably will never find an approach that helps everyone. Therapy approaches are continuously developed, evaluated, refined, changed and re-evaluated in different groups of people for different difficulties. So what type of therapy is best for you? With many options available to you, both online and in person, how do you choose the right type of therapy? Well, the answer is twofold. For those who have diagnosed condition, you consult the NICE guidelines to see which type of therapies are effective for that condition. However, choosing therapy is not usually the right approach. Instead, you should look for a therapist you feel you can trust and then allow them to introduce the right therapy choices collaboratively with you. It's also worth doing a bit of reading on different types of therapeutic approaches like CBT, CFT, DBT, psychodynamic, systemic, EMDR and ACT to get an idea of what is involved and whether you think it might be a fit for you. But it is difficult for you to have an idea about which type of therapy will work best for you at the start. So we would advise that when starting therapy, you're deciding in terms of your fit with the therapist, their personality, how comfortable you feel with them, and the rapport and trust you envisage you could have together, as opposed to the type of therapy that they offer.